We're familiar with opioids and their intended uses for analgesia, for antitussives, to relieve diarrhea. Lamotil is a drug that contains an opioid that is for diarrhea, and as an adjunct for anesthesia induction. But unfortunately, because opioids make people feel relaxed and many people experience a sense of euphoria, they are abused quite a bit. We know about tolerance and physical dependence, but people can become psychologically dependent and thus addicted as well. You know about the central nervous system effects of opioids, but also they cause histamine release and so can cause itching of the skin, constipation, and so on. Um, the A drug that is an opioid that has no medicinal use and that is commonly abused is heroin. And heroin can be injected, it can be snorted, it can be smoked, and it causes a euphoric rush and then this very relaxed state for several hours afterward. Of course, we know that in the case of opioid overdoses, large doses cause the extreme respiratory depression and actually respiratory arrest. They can. Opioids that have known medical uses, like fentanyl, like hydromorphone, which we is part of Vicodin, like morphine, like oxycodone, which is part of OxyContin. Those can also be abused. So can methadone, which is a longer acting opioid that's actually used for people who are attempting to um, kick their opioid addiction. And it's supposed to be used as a way of helping to wean people off of an opioid addiction, but unfortunately, it can also be abused. We know about the adverse effects of opioids, um, including in the central nervous system and in the outside the central nervous system. So, what happens? And of course, we know about the risk of toxicity with sedation, coma, and respiratory depression, respiratory arrest. So, what happens to somebody when they are attempting to withdraw or when they are not able to get their opioids if they have an addiction and they go into an abstinence state or have opioid withdrawal? The the worst or the peak period for the withdrawal signs and symptoms is the first 1 to 3 days, but it can last as long as a week. And the signs of opioid withdrawal include just a craving for drugs, trying to find it, the drug seeking behavior. Mydriasis, which is a dilated pupil. Remember, if you're taking opioids, the pupils tend to constrict. When you're withdrawing, the opposite happens. Dilation, diaphoresis, the runny nose, runny eyes, diarrhea, of course, which is also an opposite effect of what morphine does or any opioid does. It tends to cause diarrhea, hypertension, and tachycardia. And the people are going to feel crampy, nauseous, they'll be vomiting, very anxious. The signs of opioid withdrawal are pretty classic and potentially people can have a very bad experience on opioid withdrawal if they're just trying to go cold turkey or suddenly without it. So, how are the signs of abstinence, opioid abstinence or withdrawal treated? Um, I added something to the slide here. For someone who is acutely withdrawing, there are some medications that are used, including clonidine, which we know as a centrally acting alpha adrenergic agonist drug. It's an antihypertensive. It's used to treat high blood pressure, and it's useful in acute opioid withdrawal because hypertension is one of the and tachycardia are a couple of the signs that people experience as they're withdrawing or detoxing. And clonidine lowers the blood pressure, it slows the pulse, and it can also decrease the sweating, the diaphoresis, and even the irritability that people feel. So acutely, the clonidine can be given. Now, addiction-focused opioid withdrawal, when someone is trying to treat their opioid addiction, often involves use of the methadone with gradual withdrawal of the methadone. A naloxone or naltrexone, which are opioid antagonists, can also be part of addiction-focused treatment of opioid of opioid withdrawal, because those actually block the opioid receptors. As you know, they're antagonists. And so if the person does inject or ingest or whatever opioids, there will not be any feeling of euphoria. And of course, part of the management of addiction, a very big part, is counseling and behavioral therapies by the alcohol and other drug abuse or AODA counselors. There's inpatient and outpatient treatment for addiction, but the acute withdrawal has to be managed, and people have to be supported so they get through that period safely.